If you have the latent TB, probably you might be okay. But if you have the active TB, then dude, it gets really complicated. Hello and welcome to my YouTube channel. If you've not subscribed to my channel, I highly recommend that you subscribe. But if you've already subscribed to my channel, I just want to say thank you for subscribing to my channel. Thank you for your support and thank you for watching all my videos. And today I'll be talking about a very, very important topic. And this is about the medical that you're required to undergo, like if you are trying to apply for an immigrant visa. So if you're coming here as a DV lottery winner or you're coming here on green card, you will be required to complete a medical and you have to go through a civil surgeon or somebody who's been appointed by the US government at your local country to complete this test. So if you won the DV lottery, you'll be required to go for a medical checkup or just to complete some tests to ensure that you don't have any communicable diseases that when you come here, they will pose a risk to everybody. So the medical checkup pretty much, when you go there, they're not checking like if you have cancer. It's not like your typical visit to your primary care provider. So these are just like civil surgeons, which are designated civil surgeons. They're designated by the United States government, and then they're authorized to perform this test so that to ensure that when you come here or you're given an immigrant visa to come here, you don't have anything that will pose a risk to yourself or other people here. So it's just to keep everybody safe. And like I said before in my previous videos when I was like talking about the DV lottery, like they will not deny you a visa based off of like a chronic illness. Like if you have, congestive heart failure, people with HIV and all these diseases, they just, they will deny you a visa if you have something that poses a risk either to yourself or the other people. And that's what I'll be addressing in this video, so that to make sure like anybody who's looking for an immigrant visa or anybody who won the DV lottery know what to expect when they go for the medical checkup that is required when you go to the interview. You need to get this checkup done, and then the surgeon needs to sign, and they need to put all that results, all the information in an envelope, which you're not required, you're not supposed to. And today I'm not going to be talking about all those tests. I'm just going to focus on one that I feel like it's important, that's vital, that can make you get denied the visa. So getting denied the visa based off of the test results, literally you're not getting denied the visa. They will just prolong it in such a way that by the time you get the results, the processing might be, over, and that way you can't continue processing the visa. Literally is an implied denial. Like they're denying you without telling you they're denying you, so they're being nice about it. But actually, this can make you, if you won the DV lottery and you have all the qualifications and you met all the requirements, having this will make you get denied or disqualified. And we'll be talking about TB, also known as tuberculosis. So tuberculosis usually in America is pretty much, a lot of it is eradicated. They did all these measures, they treated people, so there's no, it's not a disease that's much of concern here. But in third world countries like where I'm from, it's very common over there. And in some countries, in Brazil and some other countries, it's really, really an issue that literally everybody there has straight up has to go for an x-ray. But then in other countries, it's not as much, but then that doesn't mean it doesn't exist. It's there. So that's why I'm gonna be educating you to how the testing is done and the implication of the results. To begin, we have to focus about what's the implication of if you test positive. So if you go for the medical and then you test positive for tuberculosis, you'll be required to get treatment, and you have to complete the treatment to actually continue processing your visa. So if you are positive, you have to take the treatment and then once you're cleared by the doctor, then you continue processing your visa. The treatment takes a long time, and that's why it's important, or it's vital. The timing is vital, because if the treatment takes like 6 months or takes a year and you're a DV lottery winner, what does that mean? By the time you finish completing the treatment, the processing for your fiscal year will be over, so you can't continue processing your visa. So this doesn't happen to a lot of people. It's not like a lot of people who test positive for tuberculosis, but since it happens, it's better to get the word out there. So if anybody's going through this, they might need to do something right away, before they wait until it's too late, and then you go there and then maybe you have only 2 months until you have to immigrate, or before they close the processing of the lottery winnings, and then you end up like, okay, you're too late. You're not gonna have enough time to get treatment before you actually process the visa. That is very important, that you know what this process entails, and that's what I'll be covering in this video. I'll just be doing a brief rundown on how the testing is done, so that you're aware of what to expect. So I'm just going to be giving information. I'm not an expert, so let me start there. I'm not an immigration expert, I'm not a civil surgeon, so I'm just giving information based off what I know, or from the experience of the people around me. So if I give you all this information and you still have a question, or maybe there's something that maybe I said it and maybe something changed, it's important you double check with your immigration lawyer. I'm trying to just create awareness so that it exists and that it happens. But then if you have any questions, you need somebody to explain further, that won't be me. Make sure you contact an immigration lawyer or a provider or a doctor, because that way they can give you information that's actually proven and it's facts. So let's just begin by how the testing is done. So with the tuberculosis, usually sometimes they inject a fluid in your arm, usually it's this part of your arm, the top here. So they inject a little tiny fluid. They don't inject all the way into the subcutaneous tissue or into the muscle or anything like that. It's just superficial up here. So they will inject the fluid up here, and then sometimes they tell you to go home and come back after 72 hours, after 48 hours, after 2 or 3 days. And then when you come back, then they check if there's a bump, if there's a raised bump in an indentation. So they will check here to make sure if you have a raised bump, and then if that's the case, then it's indicates there's something, is a positive case that they have to investigate further. And it's important to note that if you have the indentation, they inject something under your skin, the fluid, and then it swells up, there's a hard bump that develops, and then it says it's positive. It doesn't necessarily mean you have the TB, because usually people who are born in Africa, they get vaccinated, and they get vaccinated with BCG. So if you get BCG, a lot of people who got that type of vaccine end up with positive tests on the skin, on the TB skin test. Not because you have the TB, it's just because you got that vaccine, and then that vaccine, people who got it tend to have positive results on the tuberculosis skin test. So that's to say, if you get a positive skin test, don't be too concerned, don't be too worried that you have the tuberculosis, or you're infected with the tuberculosis bacterial infection. So that's one. If you got a BCG vaccine, you tend to test positive on the skin test. The second thing is, maybe you are exposed to the tuberculosis bacteria. You're exposed to it. Maybe you had a family member with tuberculosis. You went into a matatu, over there you went into public transportation, uko kwa mat, and mat iko na a lot of people. So kama uko kwa matatu, and then there's too many people there, if somebody has TB and they cough, guess what? You're exposed to the bacteria. It doesn't mean that you'll develop active disease, but then it just means that you're exposed to the disease at some point. And that, like if you get the skin test, you will test positive, not because you have the TB, but because you are exposed either knowingly or unknowingly. You might be going to visit your relative who's admitted at the hospital. And then maybe in America, the hospitals do a good job about isolating, patients. Like usually if a patient has a TB and then, they get a private room, the room has to have negative pressure so that, and then, even the caregivers have to put special masks, like N95s and stuff like that to make sure that they're not exposed to the TB. In Africa, it's a little bit different because you go to the hospitals there, especially in places where there's poverty or they don't have good access to healthcare. You'll find 20 patients in a single room. So if you have one patient with the tuberculosis, infected with the tuberculosis, guess what? All the 19 patients in the same room are exposed to the TB bacteria. But it does not mean that they will develop active infection. It just means they're exposed. So which means the skin test, if you go to get the skin test for the immigration because you're exposed at some point, is going to come back positive. So when it comes back positive, so the next step is to check your blood, see if you test positive in the blood. And then if you test positive in the blood for the TB, then probably the provider will try to see if you have any symptoms. Do you have any night sweats? Are you coughing? You have consistent cough. Do you have any fever? Do you have any rash? Do you feel weak? Do you have unintentional weight loss? Do you have phlegm? So they will try to check if you have other symptoms accompanied with a positive result. And usually if you test positive, they will require chest x-rays. In some countries like Brazil, I think at some point, if you go to immigration, they don't bother with a skin test and whatever. Everybody will get a chest x-ray. You get a chest x-ray. And if you're going to get an x-ray, if you're pregnant, usually they say that, if you're pregnant, they don't advise you to get x-rays. But then if you have time is of essence and you need to get that visa, then you'll be exposing your baby to the radiation because you're going to come to America. So you just have to understand so that you know what to expect. So if you have symptoms, they'll require a chest x-ray. So you'll need a chest x-ray done to see if they see something in the x-ray. So now that you are sent to get an x-ray, it brings us to the two types of TB. One is the latent and the other one is the active. If you have the latent TB, probably you might be okay. But if you have the active TB, then dude, it gets really complicated. Now you're required to get treatment. So having the latent TB, pretty much it shows you're exposed. Maybe you had a family member who had TB, or maybe you're exposed in your community, the environment around you, you got exposed, but you don't have the active disease. So probably you might be cleared to continue processing your visa, depending on whatever your civil surgeon deems is safe for you and for the population. So depending on what your civil surgeon recommends, you might continue processing your visa. So you'll go to the interview, and then they will ask you, they might put you on treatment. In some cases, they'll start you on medication to the Department of Health, and then you have to take this medication for a period of time. But then, so you'll be able to process or continue processing your paperwork. And this, in this type, maybe there will be no delays. So you'll just continue going to the, go through your visa. You can choose to take the medication. Some people choose not to take the medication. But because you're not a danger to everybody, they might, let it slide. Or in some cases, they'll be you need to take this medication. And then you'll have to take those medications to make sure like later in your life you don't develop the TB, actual active TB. And it doesn't mean like if you have latent or you have the infection in you that's dormant, that you might develop TB later in life. Some people do, some people don't. So it doesn't mean that you'll develop the disease later in life. So pretty much like if you have latent TB, your chest x-ray will be unremarkable. So it won't show like any signs of the disease. But let's talk about people with active TB. So for example, you go there and then they do an x-ray and then they find that you have active TB. And some people have active TB, but then when it's like, starting, you don't have those, like you don't have symptoms yet. Usually some people develop, symptoms as they go. So if you don't have any symptoms, or maybe you have just like a slight cough or whatever, and you've never, not had a chance to get checked, so you might be positive and not even know it. So if you have active TB, you cannot be given a visa, because with the visa, especially the immigrant visa, there are certain categories of diseases that you cannot get a visa. So with latent tuberculosis, usually you get classified as a class B. So if it's class B, not much concern. But if you're class A tuberculosis means like you actually actively infected and you're portraying symptoms, and you're at risk to like, you can spread the bacteria. So, and the way TB is spread, pretty much, somebody coughs, they go like, they cough in the air. When you cough in this room, bacteria, it stays just in the air. So if somebody walks in this room and actually breathes in the air, they're exposed to just like that. That's why it's very important that, the US tries to like limit the number of people coming here. And if you're enjoying this content and you think this content is very helpful, please don't forget to like, don't forget to subscribe, don't forget to share this content so that it can be recommended to other users on YouTube. And that way, if that happens, guess what? You're helping your neighbor, you're helping your friend, you're helping somebody else who's a stranger who actually needs this information. So click the like button, don't forget to subscribe, and don't forget to share. And once again, thank you so much for your support. So if you test positive or you have active TB, you have to get treatment for all that period of time. So let me give you an example. So you are a DV lottery winner, and then you have a high case number. And high case number, I'm talking about you're in the 40,000 or 50,000. Like you have a high case number. Even 30,000 in this case. It will be a high case number, because you get your 2NLs and then you start processing whatever you need to process, and you go to the medical and they find out you have TB, active TB, and they're like, hey, you need to get a treatment for 6 months. So, like with the DV lottery, they only process until the 30th of September. So 30th of September of every year, they stop processing the DV lottery wins. So maybe you got your 2NL and then your interview is in April, or your interview is in May. So you test positive in your medical test for TB, and they tell you you need to get treatment for 6 months or a year. So let's put it at 6 months. So if your interview is in May, so you have May, June, July, August, September, October. So by the time is October, guess what? They stopped processing the visa last month. So you had until last month to get your visa. So guess what? You cannot continue processing your visa. What ends up happening is you wasted your money, because medical is money. Everything is money. You have to book the interview, you have to do all these things, and it involves money. And then you're there, you tested positive for TB, and then you end up not getting a visa. So a lot of people get like really stressed, depression after that, because guess what? You invested all your energy. You knew you're coming to the United States. You invested all this money. A lot of people have contributed. Maybe you're not from a you're not from a well-to-do family, so they've contributed to everything, and then now you're not getting the visa because you have TB. So they don't deny you the visa. They actually tell you to go get treatment and come back, but then by the time you come back, they've stopped processing the visas. And like I said again, I'm not a civil surgeon and I am not an immigration lawyer. So that's why I'm just giving it from my experience and from other people's experience. So it might be different. So you need to contact your immigration lawyer to advise you on what you need to do. Take this as awareness, but you need to follow up with an expert to advise on what you need to do in case you tested positive for TB, or in case you're processing your visa and then you're suspecting that you're positive for the tuberculosis, or you were exposed to the tuberculosis and now you feel like you're developing symptoms, so that you need to get advice from a professional so that they know what you need to do, if you need to invest in the processing of the visa, or if actually it's not worth it. So after I told you all that, and I told you, like, you might miss a visa because you're testing positive for the tuberculosis, what I can advise, I don't know if this works. Like I said, I'm not an immigration lawyer, so I don't know if it's gonna work. So if you know that you were exposed to the tuberculosis at some point, or you might have symptoms of tuberculosis, you've been coughing, and usually you have like sputum. Sometimes they can test your sputum to see if, like, the sputum comes back positive for something. Get tested. Get your x-ray done right ahead of time, especially if you won the DV lottery. So my advice for anybody who won the DV lottery, like if you won the DV lottery like last year, so you're waiting for your interview, you're waiting for all that, but then at the back of your mind, you might have been exposed. Either you work in healthcare in Africa, or you have a family member who had TB, or you just have a persistent cough that doesn't go away. It doesn't hurt to get checked out. Go get the sputum tested, because they can test your sputum and then it can come back with certain if it's positive, then you might have it. So get it tested, so in case you need to start treatment, just start treatment ahead of time, and make sure. So go to a hospital that's like reputable, and hospital, like, if they have to send their documentation or whatever to the embassy, it will be acceptable. If you go to like a dispensary or whatever back home in the village or whatever, there's some hospitals that are not recognized by the United States Department of Health or whatever, United States Embassy and stuff like that. So you need to go to a good hospital if you test positive. They will do an x-ray, so they have a baseline x-ray, and then they will start you on treatment through the Department of Health or through anything. So once you are in the treatment already, and maybe you get an interview, and then when you go to an interview, you tell them, like, what, I tested positive, like, when you go for your medical, you can tell your medical surgeon, so I tested positive for TB like 6 months ago, and I went to this hospital, they have my records, and they started me on treatment, and they only have 1 month left of treatment to go, or I have 2 months left. So, or maybe I completed my treatment successfully, and then I have documentation. So that way, even if your civil surgeon, like, they find that you test positive or whatever from the scarring, whatever old infection, once they find that, they can show, like, you got treated for it, and then they have documentation from this other provider that maybe your civil surgeon can include that. They're like, yeah, she tested positive, or he tested positive, he got treatment, and then now they give you the folder, and after your medical, they give you the folder. You're not supposed to open that thing. Like, you open that envelope, that's it. You have to go back and redo it again. So that's what, like, I was thinking. I don't know if it works or not, but then, like, if like you won the DV lottery, instead of losing a chance like that, I don't know if you get treatment ahead of time. Just get treatment, complete the treatment. By the time you get your 2NL and all that, you already completed your treatment, or you are in the process. So in case, like, they require 3 months, you won't run out of time to process your visa. And like I said, this is just my advice. I don't know if it works. So you need to contact the immigration lawyer. You need to contact your doctor, civil surgeon, where you live, so that they can advise on what you need to do. But then I just felt it's really important, because a lot of people don't know, especially in Africa, they don't know. And it's, Africa, we live in crowded spaces. So TB, the way it's spread, somebody can be coughing, somebody can be singing, somebody can be shouting in the room. And when they actively have the bacteria, they will just sing in this room. And everybody who gets in this room, or anybody who's in this room, might be exposed.